Jerald Carmel. I'm a foot and ankle sports medicine physician here at Mount Sinai Medical Center. And my patient, Thomas Abrahams, a patient of mine that we've been giving instruction on how to train and to do a marathon without getting an injury. Mr. Abrahams had a slight job preparing for this marathon for St. Jude's coming November 2nd. And inadvertently in the job, he stepped off a curb, twisted his foot, and created a torque injury to his fifth metatarsal that fractured and comminuted at the base of that fifth metatarsal. So you can see the fragment. There's the fracture. This is the fracture.
Yeah.
And this is the comminuted edge, this little triangle. And it's also cracked up through here. What does that mean? It means that if you're going to go on this, you're going to do it in a wheelchair. Well, I'll put you in a cast today.
Cast?
I have to see what's going to happen in 3 weeks. The X-ray in 3 weeks will tell us a lot what you can do and what you can't do.
Okay.
It's usually a 3-month injury.
How about speed walking?
The problem is that this is the location of a muscle on the outside of the leg, the peroneal muscle that inserts into this fragment, the tendon. So every time you step down, it fires.
So in 3 or 4 weeks, you see where the healing's done.
Exactly. So I can tell you how aggressive you can be on that.
Okay.
Because it prohibits him from running. And we are trying to find a sensible medical way for Mr. Abrahams to still participate in this race. One of these avenues is that Mr. Abrahams will be in a cam walker when he's not using crutches. You can understand that this fracture normally would prohibit somebody from entering a race. I've assured Mr. Abrahams that I'll allow him to go into the race. He would just be modified and he won't be able to run. It will be basically a race where he will do some walking. Hopefully we can get him to go into a faster pace. Right now he'll be totally off-roaded in crutches. And we're informing you of this because he has so much at stake. He's a wonderful humanitarian and philanthropist, and he's committed to participating and is allowing me to videotape this session so that you know that his doctor is behind him 100%.